Welcome to The Ultimate Guide, Unveiling Vortioxetine's Side Effects, Uses, Dose, and Mechanism of Action. In this comprehensive video, we delve into the key aspects of vortioxetine, providing you with the vital information you need to know. Vortioxetine, a popular medication used for the treatment of major depressive disorder, has gained attention in recent years. But what are its side effects, and how does it work? We'll explore these questions and more as we uncover the essential details of this medication. Discover the potential benefits and risks associated with vortioxetine. From its mechanism of action to its recommended dosage, we leave no stone unturned in shedding light on this intriguing pharmaceutical. Whether you are a healthcare professional looking for in-depth knowledge or a patient seeking a better understanding of your treatment options, this guide is tailored to suit your needs. Our aim is to provide accurate, reliable, and easy-to-understand information that empowers you to make informed decisions regarding vortioxetine. Join us as we unlock the mysteries surrounding vortioxetine and illuminate its role in managing major depressive disorder. Let's begin this enlightening journey together. Understanding vortioxetine's mechanism of action. Vortioxetine's mechanism of action is complex and involves multiple neurotransmitter systems in the brain. Unlike many other antidepressants that primarily target serotonin reuptake, vortioxetine works as a serotonin reuptake inhibitor and receptor modulator. It acts on several serotonin receptors, including 5-HT1A, 5-HT1B, 5-HT3, 5-HT7, and the serotonin transporter. By modulating these receptors, vortioxetine aims to enhance the availability and balance of serotonin in the brain. The modulation of these receptors is thought to contribute to vortioxetine's antidepressant effects. The activation of 5-HT1A receptors, for example, has been associated with increased serotonin release and improved mood. Additionally, vortioxetine's interaction with the serotonin transporter inhibits the reuptake of serotonin, leading to increased serotonin levels in the synaptic cleft. Understanding vortioxetine's mechanism of action is crucial in comprehending how it exerts its antidepressant effects. By targeting multiple serotonin receptors and the serotonin transporter, vortioxetine aims to restore the balance of neurotransmitters in the brain and alleviate depressive symptoms. However, it's important to note that the exact mechanisms underlying vortioxetine's antidepressant effects are not yet fully understood and further research is ongoing. Common uses of vortioxetine. Vortioxetine is primarily used for the treatment of major depressive disorder, MDD, in adults. It is prescribed when other antidepressant treatments have been ineffective or poorly tolerated. MDD is a debilitating mental health condition characterized by persistent low mood, feelings of hopelessness, loss of interest or pleasure in activities, and various physical and cognitive symptoms. Vortioxetine has shown efficacy in reducing depressive symptoms and improving overall well-being in patients with MDD. It may help alleviate symptoms such as sadness, lack of energy, sleep disturbances, and difficulties in concentration. It is important to note that vortioxetine is not indicated for the treatment of bipolar disorder or other psychiatric conditions. In addition to its primary use in MDD, vortioxetine has also shown promise in the treatment of generalized anxiety disorder, GAD. GAD is characterized by excessive worry and anxiety about various events or activities, often accompanied by physical symptoms such as restlessness, fatigue, and muscle tension. While more research is needed to establish its effectiveness in GAD, initial studies have shown positive outcomes. Recommended dosage and administration guidelines. The recommended starting dose of vortioxetine for adults with MDD is 10 mg once daily. Depending on the individual's response and tolerability, the dose may be increased to a maximum of 20 mg per day. It is important to follow the dosage instructions provided by the healthcare professional and not exceed the prescribed dose. Vortioxetine can be taken with or without food, as food does not significantly affect its absorption. However, it is advisable to take it at the same time each day to maintain a consistent level of the medication in the bloodstream. If a dose is missed, it is recommended to take it as soon as remembered, unless it is close to the next scheduled dose. In such cases, the missed dose should be skipped to avoid doubling the dose. For patients with hepatic impairment or moderate to severe renal impairment, dose adjustments may be necessary. It is important to consult with a healthcare professional to determine the appropriate dosage in these situations. Additionally, vortioxetine is not recommended for use in individuals under the age of 18 due to limited safety data in pediatric populations. Potential side effects of vortioxetine. As with any medication, vortioxetine may cause side effects in some individuals. The most common side effects reported include nausea, diarrhea, dry mouth, constipation, and vomiting. These gastrointestinal symptoms are usually mild to moderate in severity and often subside over time as the body adjusts to the medication. It is advisable to take vortioxetine with food to minimize the likelihood of experiencing these side effects. Other potential side effects of vortioxetine include dizziness, headache, blurred vision, abnormal dreams, and sexual dysfunction. These side effects may vary in frequency and severity among individuals and should be discussed with a healthcare professional if they persist or significantly impact daily functioning. In rare cases, vortioxetine may increase the risk of serotonin syndrome, a potentially life-threatening condition characterized by agitation, hallucinations, rapid heartbeat, fever, muscle stiffness, and coordination difficulties. It is important to seek immediate medical attention if any of these symptoms occur. Precautions and contraindications for vortioxetine use. Before starting vortioxetine, it is essential to inform the healthcare professional about any pre-existing medical conditions, including liver or kidney disease, bleeding disorders, or a history of seizures. Vortioxetine should be used with caution in these situations, and dose adjustments may be necessary. Vortioxetine is contraindicated in individuals who are hypersensitive to the medication or any of its components. It should also not be used concomitantly with monoamine oxidase inhibitors, MAOIs, or within 14 days of discontinuing MAOI therapy due to the risk of serotonin syndrome. Pregnant or breastfeeding individuals should consult with a healthcare professional before using vortioxetine, as its safety in these populations has not been adequately studied. It is important to weigh the potential risks and benefits before initiating treatment. Interactions with other medications and substances. Vortioxetine may interact with certain medications and substances, potentially affecting its efficacy or increasing the risk of side effects. It is important to inform the healthcare professional about all medications, including over-the-counter products, supplements, and herbal remedies, being taken concurrently with vortioxetine. Specifically, vortioxetine may interact with MAOIs, selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, anticoagulants, antiplatelet drugs, and medications that affect liver enzymes. These interactions can lead to increased serotonin levels, bleeding complications, or changes in vortioxetine's concentration in the bloodstream. Alcohol consumption should be minimized or avoided while taking vortioxetine, as it may increase the risk of drowsiness, dizziness, and impaired judgment. It is important to follow the healthcare professional's advice regarding the use of alcohol while on vortioxetine. Frequently asked questions about vortioxetine. Can vortioxetine be used as a first-line treatment for major depressive disorder? Vortioxetine is generally not recommended as a first-line treatment for MDD. It is typically considered when other antidepressant options have been ineffective or poorly tolerated. However, individual circumstances may vary, and healthcare professionals will determine the most appropriate treatment plan based on the patient's specific needs. How long does it take for vortioxetine to start working? The onset of vortioxetine's therapeutic effects can vary among individuals. Some individuals may notice an improvement in symptoms within a few weeks of starting treatment, while others may require several weeks or even months to experience the full benefits. It is important to follow the prescribed dosage and consult with a healthcare professional if there are concerns about the medication's efficacy. Can vortioxetine be used in combination with other antidepressants? Combining vortioxetine with other antidepressants should be done under the guidance of a healthcare professional. In some cases, a healthcare professional may prescribe a combination of medications to optimize treatment outcomes. However, the potential risks and benefits of combining antidepressants should be carefully considered, as certain drug combinations may increase the risk of side effects or interactions. Are there any long-term effects of vortioxetine? The long-term effects of vortioxetine are not yet fully understood. While studies have shown its efficacy and safety in the short-term treatment of MDD, further research is needed to evaluate its long-term effects. It is important to monitor the patient's response to vortioxetine and regularly reassess the treatment plan in collaboration with a healthcare professional. Exploring alternative treatment options. While vortioxetine can be an effective treatment option for major depressive disorder, it is not the only approach available. Alternative treatment options may include psychotherapy, such as cognitive behavioral therapy, CBT, interpersonal therapy, IPT, or mindfulness-based therapy. These therapies aim to address the underlying causes of depression and equip individuals with coping strategies and skills to manage their symptoms. Additionally, lifestyle modifications, such as regular exercise, a balanced diet, sufficient sleep, and stress reduction techniques, can play a crucial role in managing depressive symptoms. It is important to discuss these alternative treatment options with a healthcare professional to determine the most appropriate approach for each individual. Conclusion: making informed decisions about vortioxetine use. In conclusion, vortioxetine is a medication used for the treatment of major depressive disorder. Its mechanism of action involves the modulation of serotonin receptors and inhibition of serotonin reuptake, aiming to restore the balance of neurotransmitters in the brain. Vortioxetine has shown efficacy in reducing depressive symptoms and improving overall well-being. When using vortioxetine, it is important to follow the recommended dosage and administration guidelines provided by a healthcare professional. Potential side effects, precautions, and contraindications should be considered, and any concerns should be discussed with a healthcare professional. While vortioxetine can be an effective treatment option for MDD, it is not the only approach available. Alternative treatment options, such as psychotherapy and lifestyle modifications, may also be considered in collaboration with a healthcare professional. Ultimately, the goal is to make informed decisions about vortioxetine use based on accurate and reliable information. By understanding its mechanism of action, common uses, dosage guidelines, potential side effects, precautions, and alternative treatment options, individuals can work together with healthcare professionals to develop a comprehensive treatment plan tailored to their specific needs. Thanks for watching.